Welcome everyone to Women Talking Wednesday on April 2nd of 2025, brought to you by Healthier Life. My name is Rena Carlini and I'm the CEO and founder of Healthier Life, and welcome to this special learning event today. Today we will be talking about hormones and skin and how to navigate those skin changes that happen through every stage of your life. I'm really glad to see everyone here. Joining us today for this special presentation by Healthier.life. We are your women's healthcare navigator. You know, we're gathering here today on these special events we call Women Talking Wednesday because women like us want better options for our hormonal health. And we also want to join a community of women to learn more about what we can do with our hormonal health conditions that are bothering us. And we want to be heard and we want to connect with women's health experts. And so that's really the mission of Healthier Life. We are a women's healthcare navigator platform based in Canada, but operating across the globe. And our purpose is to connect our members to trusted, evidence-based health solutions that give personalized patient support as well as faster access to physician specialists like our guest today, Dr. Serena Pisani, who you'll meet shortly. And our goal is really to help you manage a chronic hormonal health condition like menopause complications, PCOS, endometriosis, thyroid, and others. And we will give you a few more information about a variety of women's health solutions that we offer on our platform, which range from our Knowledge Center that have science-based learning articles, as well as our Women Talking Wednesday events like today, our telehealth MD consultation services, our marketplace of quality assured women's health products and services, and our community hub for members like you so you can make meaningful connections. So if you haven't already started your journey as a community member of our platform, you could start today, join for free as a community member and get the healthier life you deserve. Just point your camera your cell phone camera at this CAPTCHA and you can get straight to our website that way. And we must provide this disclaimer regarding the health information that is going to be shared today. Healthier Life's goal is to help our members be well informed about their hormonal health and provide you with trusted evidence-based health information from our licensed physicians and allied health professionals. However, the information that we share today in our learning content should not be received as direct medical advice about your personal health. And we always advise you to consult with a licensed family physician or allied health professional to discuss a diagnosis or a treatment or to seek personalized medical advice for your health concern. And with that, I want to turn attention to our special topic today, hormones and skin, navigating skin changes through every stage of life. And we're so pleased to have Dr. Serena Pisani join us today. And I'd like to give a background bio about her before she joins the screen. So Dr. Pisani is an endocrinologist practicing in British Columbia, and she is the medical director of the Mercer Clinic, which is based in Vancouver. She's also a clinical instructor at the University of British Columbia's Faculty of Medicine. And since 2024, we've had the honor of having her support us as a medical advisor for our platform. She completed her medical education in Ireland, and following that did her residency at Western University in Ontario, as well as a fellowship at the University of Toronto. She is certified in internal medicine and endocrinology, serving adult patients, as well as metabolism care, and has specialized training in aesthetic medicine. Dr. Pisani is really passionate about women's health, and her areas of interest include PCOS. She's actually one of the few well-versed specialists in polycystic ovarian syndrome and endocrinology in Canada, as well as an area of interest in aesthetic medicine and skincare, menopause, thyroid and pregnancy, and other areas of women's health. So with that, let's get started. I'd like to introduce Dr. Serena Pisani. Welcome.
Hi, thank you for having me and for the lovely introduction. And I'm just honored to be here today.
Awesome. Thank you so much. I know you're coming to us really early in the day from Vancouver. We're headquartered here in the Toronto area, so there's a 3 hour time difference. So thank you so much for spending the next hour with us and all of our guests here today. So I'm going to begin while we wait for some questions in the chat. I'm going to begin with some questions. So Dr. Pisani, as a physician, tell us why you chose to specialize in endocrinology amongst other areas of medicine, and why are you focusing on conditions like PCOS? Because endocrinology is quite diverse, an area of study, and why PCOS and fertility, and even gaining more specialty in menopause care as you diversify your practice. And also tell us about the addition of aesthetic medicine and cosmetic skincare certification that you have.
Thank you. Well, for me, I'm a big advocate for women from a young age, and I always knew that I wanted to go into women's health, either gynecology or endocrinology. And as I went through my training, and at around the same time, I was watching myself and the women around me go through so many hormonal changes, including my mom, who was going through menopause, while I transitioned with my own struggles with polycystic ovarian syndrome or PCOS, and then was pregnant actually in my final years of training and experienced hyperpigmentation and acne and just, kind of was going through the motions of my own skin journey and my own hormonal health and then seeing those around me. So that is really where my passion for women's health came from an early age, just knowing that women struggle with so many hormonal fluctuations, which is unique also from men, and that we struggle a lot to take care of ourselves and prioritize our own self-care. So I always wanted to be an advocate for that. With that came the hormones, since we know that's the powerhouse of a lot of things in our body and does regulate a lot of our organs. And from there, I found the connection with cosmetics is actually strongly related to hormonal health. And it is actually, they go very hand in hand together. So that is how the journey happened, and partly personally and looking at the women around me.
Mhm.
So I wanted to join forces with both hormones and skincare to combine them because I don't think that they're singular. In fact, they're very much intertwined.
Mhm, mhm. Well, we certainly notice that through observation, of course, but it's always great to hear it from a physician who's trained in this area and can help kind of demystify and explain what those connections are. And I think that's what we're going to learn from you today. Share that knowledge with us as best as we can appreciate it, because I know there's a lot of complexity with the endocrine system and how it impacts many other parts and systems in our body. So this is excellent. And tell us about the passion with getting licensed in aesthetic medicine and treating some of the patients in your clinic for skin care issues that relate to their hormonal conditions that they have.
Yeah, so I think a lot of women are coming to me for their hormonal health. We're checking their hormones, and I'm able to see what's actually going on within their body and then correlate that. So, for example, if it's menopause, that strongly correlates with, drops in collagen and hydration in the skin. And so I'm able to test that with blood work and have the proof that this is what's going on, and then look at the evidence behind the skincare. So I'm actually able to tell you what's going on with your hormones and apply, these are the products or these are the things that are going to help you with this specific hormonal issue. Or in a different diagnosis would be polycystic ovarian syndrome, which has different hormonal regulators, and we'll talk about that with regards to testosterone and male hormones and how that can contribute to things like acne. And then there's very specific things that are evidence-based, not just skincare, there's medications, there's topical agents that can go along with that. So really it's looking at the science behind it and applying appropriate things versus going to different spas where you're not necessarily getting that diagnosis and that underlying blood work and understanding the underlying physiology.
Yeah, no, that's excellent. So it's much more integrated and comprehensive when it's coming from a clinic like yours, where there's, understanding the root cause behind the skin issues so you can appropriately treat them. You mentioned collagen, which I have a ton of questions about, and I'm sure others do too. There's a lot of talk about collagen. There's a lot of talk about hyaluronic acid. There's a lot of talk about spironolactone. There's lot of talk about different types of active ingredients in skincare products. We're going to dive into that. I'm already seeing a few questions starting to come up in the chat, but I'm going to give it another couple more minutes so that others who are joining and thinking about their questions that they want to ask you can have a chance to put them here. And then we're going to stop and do questions from the chat. Um, Tell me a little bit. I'm going to ask one more question about, you know, the relationship between hormonal changes and changes that you might see in your skin through the various stages of a woman's life. Let's start, say, in your 20s, in your reproductive years. You may not be having,
Yeah.
reproductive activity in your 20s, but you're certainly in your reproductive years and, even into your mid 30s. Tell us kind of what women are experiencing at that time with hormone changes and how it affects skin. And then a little later, after a few questions, we'll dive into that perimenopause journey period
Yeah.
that we all love to hate. Um, please go ahead.
So in your 20s and 30s, you're obviously should be, unless there's other underlying medical issues, having regular menses. But just with your normal cycle, you're going to have hormonal fluctuations in estrogen, progesterone, and some people have underlying fluctuations in testosterone or androgen male hormones if they have underlying PCOS. So just with the variations in your own cycle, you are going to experience fluctuations in your skin based on the different times of your cycle. So some people might experience acne at certain times when they have their progesterone drop, or if they have excess testosterone, they might experience acne. Really, that's the hormonal aspect of things. If you look also in your 20s and 30s, you might be planning, for like fertility, and with pregnancy, there are, increases in cortisol, increases in androgen sometimes, and that can lead to acne and hyperpigmentation as well. So there are different kind of things along the way that are both part of the normal cycle and normal skin changes. And then there are some abnormal things that can pop up, and that's also lifestyle driven. You're busy working, studying, not focusing on hydration or diet. It all does interplay with each other.
Yeah, that's a really great comments and explanation in your reproductive years. And just as a quick add-on question about that, I know a lot of people feel, right before your period starts is where you start to break out and have, strange
So
little
that would
pimples.
be what we call
Yeah,
hormonal acne.
totally,
And I
totally.
see you pointing at the bottom of your face there.
Right
So
here.
hormonal acne is very specific. It's in a specific area. So it's along
Yeah,
the jawline,
yeah.
the chin. A
Mm,
lot of people talk to me about it being on the back. Hormonal acne is a little bit different. They're deeper pustules. They take
mm,
longer to resolve. They're sometimes
mm,
painful and
mhm,
cystic.
mhm,
You'll maybe have heard of Accutane, and a
mhm,
lot of people might be resistant to Accutane.
mhm.
And if you have underlying PCOS, actually 70% of people with PCOS are resistant to Accutane, and they need
Mm,
further management with something like spironolactone,
mhm,
to help manage the acne, and also get their PCOS under control.
mhm.
So that's a common thing that I see as well, but definitely the hormonal acne is going to be along the jawline,
Right.
chin, and sometimes on the back.
Right, right. And that's usually happening in that period right before menstruation starts when luteinizing hormone is high, progesterone starts to kick up, estrogen goes down. Um, so, again, for those hormonal cycles that lead, just past ovulation is when it starts to kick in, right?
Exactly.
And yeah, so that's really good. Now we have a few questions, so I'm going to start to break away to the chat board, our audience questions here before long. So the first one, big topic, comes from Adit. I hope I pronounced it right, from Toronto, and she's asking about topical estrogen creams for the face specifically. And this tends to be a product promoted for women in generally in their perimenopause years and postmenopause years. And so she writes, if so, which type is recommended? What format? Would you recommend topical estrogen for the face for postmenopausal women if they're already on topical estradiol? So they're doing transdermal estrogen as part of perhaps menopausal hormone therapy.
Yeah, that's a great question. I'm getting calls about that at my office
Oh,
regularly currently, so we knew that was going
mhm.
to come up. So currently, let's just talk about the physiology between, this is specific to perimenopause and
Yeah.
menopause, when you're getting drops in estrogen and how that affects the skin. So what happens in menopause is you get a drop in estrogen that actually reduces your transepidermal water source by almost 80%. And that reduces your by 30% in the first 5 years of menopause, and then 2% every year for 15 years afterwards. So you can imagine that the amount of water in your transepidermal layer is reducing and creating thin skin, and also loss of collagen, elastin. That's where the sagginess comes from, the wrinkles, as well as makes you vulnerable to bacterial overgrowth, causing rosacea. It also causes, risk of dermatitis, more sun exposure when your skin is thinner, and therefore risk of hyperpigmentation. Some people get worsening acne. So I think the thought around the hormone replacement therapy or topical estrogen is that it is going to increase the amount of water and reduce collagen loss. It was not, there are some small studies in 2024 double-blind studies that did show topical estrogen increases 30% of the collagen, but not elastin, which is what causes wrinkles.
Mm,
Um, Currently, it is not FDA approved in terms of safety to apply to the face, although it has been shown to show improvement.
mm,
And when you are using, say, a topical estrogen or vaginal estrogen, such as Vagifem or Imvexi, there has been shown that it actually helps with collagen about 20%. So you can imagine that if you're putting it in, say, vaginally, and it's helping your skin by, 18% or 20%, it is somewhat getting systemically absorbed. And there
yeah.
is a black box warning on even vaginal estrogen and topical estrogens. It's a big warning that there's increased risk of breast cancer or just uterine cancer, ovarian cancer, and risk of clotting. So that's clots in the legs or the lungs. And we don't really have enough studies to prove safety in terms of applying it to the face,
Mm,
although we know there could be a benefit. So
mm.
currently, I'm not recommending application of estrogen to the face topically because there are better or more products that are FDA regulated and approved that can equally increase the collagen in your face that have less risks.
That's a really great answer and very fulsome. Lots of things to unpack there because sometimes, I'm a menopausal woman. We get mixed messages about estrogen face cream. From our neighbor to the south, there's a lot of products being pushed of estrogen face creams, even those that are endorsed by physicians. And what my understanding is that, yeah, at least in Canada, it is not Health Canada approved to have estrogen face cream. Especially in people who are already taking hormone replacement therapy or menopausal hormone therapy, for menopause symptom
Yeah,
care.
so currently there is FDA or Health Canada approval for treating with HRT for your vasomotor symptoms or low bone
Right.
density,
Yeah.
but we're not, because of the risks, it's all
Right.
about quality of life,
Right.
and it's really an individual
Yeah.
basis. You would
Yeah.
be using it off label, but you should understand that there are quite big risks associated.
That's right. It has to be a discussion with your gynecologist. And for Adit's question, I would definitely recommend speaking with your physician who is prescribing you the transdermal estrogen. I know with my gynecologist, because I have taken menopausal hormone therapy, strictly told me transdermal patch or cream or gel, fine on the thighs, buttocks, typically the inside of the wrists is fine. And specifically, I know I was told, do not put it on your face, do
Yeah.
not put it on your breasts. That's and mind you, those are the higher dose estrogels, and other transdermally applied estrogen gels. They're not necessarily the lower dose face creams
Yeah,
that we're talking
exactly.
about,
But I
but at
still
the
don't
same
think we
time,
necessarily
yeah,
know.
yeah,
And we don't know the systemic
yeah,
absorption rate, so we don't
no,
know if it's getting into other
yeah,
areas and what
yeah,
that does. So it needs to be counseled appropriately. Not that, you can do it off label under the guidance of your physician, but currently I'm not I'm recommending it. I'm
yeah.
happy to go through the products that I think can help and we can get into that. I'll let
Yeah.
you guide that conversation.
That's great. And I'm sure there might be other women who have that same question about estrogen face creams, not the same as estrogen gels or creams for menopausal hormone therapy. The dose could be different, the formula could be different. If you have a question about that, just as an extension of what was just asked, please put it in the chat and we'll try to get some good clarification about it. And it will be available in the show notes with direct links from the medical literature. So we'll ensure that. Moving on to another question. This one is from Tammy, and it's about thyroid issues impacting your skin. Her question is, does this change in perimenopause, menopause? So when you have thyroid changes, either hypo or maybe
Yeah,
hyperthyroidism.
definitely. So, specifically just in general outside of menopause, so obviously the thyroid does impact the skin. It's well known in the literature that hypothyroidism contributes to dry skin and puffiness. And hyperthyroidism is an increased metabolic state. So you may be you're kind of catabolic at that point if it's uncontrolled. You may be losing muscle mass or collagen, and also getting oily skin. So both of them do affect. That being said, if it's well controlled, either on medication or with your endocrinologist or primary care provider, and the levels are normal, so by blood work you have normal TSH, then it shouldn't be. It's only if it's not well controlled that it would be contributing.
Okay, very good. I am one who also has hypothyroidism now for about 5 years, and I could tell you the dryness is incredible,
Yeah.
how it happens. And you really do have to manage your skin dryness that way,
Yeah.
even on the most humid summer day. Incredible amount of dryness. So
So
you have to,
hydration is really important for
unbelievable.
that. We can
Yeah,
talk about
yeah,
moisturizers and what
yeah,
like medical grade
yeah.
moisturizers, and we can get into that stuff as well.
Well, I think we should because
Yeah,
the
let's get
next
into
question is from Linda. And
Yeah,
Linda's probably like me. She wants recommendations for dry skin and menopause. So, again, I know as a physician, especially in Canada, you're not really permitted to be endorsing branded
no,
products, but any active ingredients that we should be
yes,
looking for in these types of products?
100%. So let's just go through it systematically a little bit. So even outside of menopause, but I'll concentrate a little bit on menopause and I'll tell you my go-tos that I've been
Mhm,
using since I was 16, actually,
mhm,
are going to be number one, lifestyle.
mhm,
Okay. So when we go through menopause or even without menopause, your skin layers are getting thinner. You are getting less blood flow to the transepidermal area. So exercise is a very important part because it actually increases blood flow to the skin. It
mhm,
balances out hormones and it reduces insulin resistance. So it also lowers androgen levels and reduces acne. So
mhm,
exercise is a really important part. Not smoking, hydration is very important because obviously if you're losing a lot of water, not able to retain water in your skin, you should be having enough water through the day. And not having too hot showers as well, because your skin is thinner. You're not having extended long showers with hot water that breaks down the skin barrier and makes you vulnerable to things like dermatitis. And diet is also very important. So if you're eating a lot of greasy or oily foods, not getting enough nutrition with like your vegetables and fruits, and protein, you're also going to get that more volume loss, more oily skin, more acne production. So that's number one, is going to be lifestyle.
okay.
Secondly is going to be just prevention. So when we're in the sun, if you have thinner skin in perimenopause or even without that, you are going to have more free radicals in the skin. You're going to get more wrinkles. You're going to get more sun damage, melasma, hyperpigmentation, or dark spots. So all women, perimenopause, menopause or not, should be wearing SPF sunscreen. I recommend over 40 or 50 through the entire year, and that's both in the summer and the winter. And the ones that have evidence are actually usually mineral-based or zinc containing. So you want to look on that and look on the actual bottles for that. And I'm a big advocate for medical grade skincare. So those are ones that have actual studies to increase collagen production, natural hyaluronic acid, and reduce wrinkles. So there are lots of different products out there that are medical grade. You can look them up. I'm not going to make any endorsement to a specific product, but medical grade skincare actually has the studies and the evidence to back up versus going to, the Shoppers Drug Marts or the Sephora's and buying over the counter. These ones actually do have what we call active ingredients. Some of those active ingredients are the mineral-based sunscreens. The other ones that I have proof, so what I was saying with when you have the topical estrogen, yes, there might be an increase, but ceramide containing products, which are lipid rich, can actually restore 89% of collagen and plumpness in the transepidermal area in menopausal women after use of just 8 weeks. Plus, and you can find that in a lot of moisturizers or serums. So ceramides are a good one. And 80%, that's better than the 30% on the topical estrogen with no risk of breast cancer or clotting.
Right.
Okay, you have your retinoids or retinol. Okay, so retinol actually is like it's an exfoliant almost. It takes away dead skin. It also helps reduce dark spots. When you take away the dead skin, because you can imagine you're applying moisturizer onto dead skin, it's not penetrating through into that transepidermal area where you have all that volume loss and that water loss. You need to use an exfoliant or a retinoid to kind of get the dead skin off and get through to the transepidermal area. So using retinol was found to actually improve collagen or pro-collagen by 58% after 6 months. We usually use our retinol in the winter months because there is risk of kind of getting almost like sunburnt in the summer months. So from fall onwards, especially if you live in rainy Vancouver, you're going to be using your retinol. I recommend starting at a low dose, so it's like 0.25%, and working your way up over time. If you're finding that it's like getting raw, then you're probably like the skin's getting red and a little bit raw and dry. That might naturally happen at the beginning, but it might mean that you need to cut back from daily use into like maybe twice a week or once a week. But ceramides, retinol, and are good ones to have. And that should be done under the consultation of your dermatologist or someone who specializes in skincare. And then the third one is vitamin C serum. So vitamin C also protects against UV rays from the sun in addition to your sunscreen, but it also helps boost collagen up to 81% in menopausal women. And that also should be used for a period of at least 6 months. And that it kind of increases natural collagen production.
Wow, this was a ton of information. I was furiously writing notes, but we're going to all have it in the show notes for
Yeah,
for
exactly.
many of our guests. So this was fantastic. So ceramides, retinol, vitamin C, almost like your daily,
And mineral-based sunscreen.
and
Okay.
mineral-based
And
sunscreens.
then
Yes.
washing your face at least twice a day, morning and evening. And for this, I'm just very simple with my cleanser, and I will go to something that is paraben, fragrance free, and very gentle on the skin. You should be washing your face for at least a few minutes, not just splashing water on it to really cleanse the dirt and, taking off all the makeup and everything every night. And I'll just go to my go-to is Cetaphil for that one. It's just over the counter. It's been dermatologically approved, and it's affordable.
Well, it's always a good recommendation when an expert in skincare and hormonal health is using a simple, basic, clean cleanser, as we call it, that's actually low cost and affordable and available to everyone. That's excellent. This was a ton of information. And it's interesting because you mentioned about how some of these active ingredients boost your natural collagen levels. And so that just, before I take a next question, that just makes me ask the question, okay, what about this oral collagen supplement? Okay,
Yeah.
that everybody is kind of talking about pushing. Um, do we
Yeah.
really need it? Is it just extraneous? Do we end up
Well,
just, excreting it out, because we can get it naturally in other ways? Give us the lowdown.
I don't think we have enough studies to prove that. It's obviously like an off-label thing and kind of on the naturopathic spectrum. I don't
Mm,
think it's harmful though. And I love the book, The New Menopause here.
mm,
And they do recommend, and she herself is a physician, and is taking the collagen. I don't think there are some studies to show that it boosts collagen. I don't think it's harmful.
mm,
You have to be careful with some active ingredients, like if it contains biotin or selenium, because there are other ingredients other than collagen,
mm, mm,
then it could affect blood work for thyroid disease, for example,
mm,
and cause a
mm,
false blood work. So
mm,
you just have to be careful of that and make sure you're telling your primary
mm,
care provider if you are having blood work that you are taking supplements or collagen, because
mm,
they may want you to stop that prior to blood work so there's no
mm,
confusion.
mm,
But otherwise, I think it's pretty low risk. If it has benefit, that's great. And there are some studies that do show
mm,
that.
mm,
And I think it's a fairly, like, if it works for you. If it doesn't, then there are the other options as well.
mm. So it's not terribly harmful, but always
Yeah,
disclose this to your health professionals that you speak
exactly.
to, in case it could interfere with blood work. So
Yeah,
that's
or if you have underlying other medical
yeah,
issues, you probably just want to get some medical advice on it.
yeah, no, that's a great, great advice. Thank you so much. We have a bunch of more questions, and I have
Yeah,
some too, but you know what? I'm gonna help make sure the attendees here get their questions answered. So I'm gonna go down the board here.
okay.
We're gonna move on to Valerie's question. Valerie from Ottawa, welcome. What are your thoughts on resveratrol or Esqual for menopause-related facial eczema?
Okay,
So
so
eczema related that
yeah,
comes with hormonal changes. Any thoughts on
yes.
that?
Well, I think that's probably more of a dermatology question. So
Hmm.
I'll
Hmm.
defer that to the dermatologist because I'm not a dermatologist, but I do know that eczema increases again due to that loss of skin barrier.
Hmm.
Um, so there is an increased risk of eczema post-menopause and in the perimenopausal phase, but I'm going to leave that question with the dermatologist. I'm not experienced enough, I feel like, to give medical advice on eczema.
Yeah, I mean, resveratrol for Valerie's benefit is an antioxidant. It's a known
Yeah,
antioxidant. I'm a natural products chemist, so I know a lot
yeah.
about resveratrol. I think I made it once in the lab years ago.
Oh my goodness.
And it actually is sourced in grapes. It's probably most
Yeah.
abundant in grapes, and in blackberries is the highest abundance of resveratrol of any fruit out there. And there's a blackberry abundance in Canada. So if you want natural resveratrol, eat a lot of blackberries and dark grapes, the red and black grapes. But it is an antioxidant in terms of its ability. And there's many other types of antioxidant active ingredients for things like eczema and other dermatological conditions. But yeah, hard to say. Good answer that this is best taken up with a dermatologist. Okay, Maya also has a question, and it's about the following. Can rosacea or pigmentation issues start late after 45 because of hormonal problems,
Yeah.
even if you have pale skin color?
Yes.
Great question.
So 100%, it can. There are a lot of sources of that. So that's just changes in hormones. As we age, our insulin resistance goes up as well. If there's a genetic or family history of diabetes or PCOS, that can also change things, as well as just the loss of estrogen and hormonal fluctuations with menopause. as well as sun exposure really does cause the dark spots and hyperpigmentation and pregnancy, because you have increasing cortisol levels, increasing androgen levels, increasing insulin resistance. So it can actually happen in multiple phases, from your 30s all the way onwards. There are many ways to treat hyperpigmentation. Again, one of them is going to be just simple avoiding sun exposure, wearing your mineral-based sunscreens through the year, wearing hats, wearing UV protected clothing. And then if you already are struggling with it and you want to diminish the appearance of the pigmentation you already have, there are some active ingredients that you can discuss with a dermatologist or someone who's a skincare specialist. And my go-to for that is going to be a hydroquinone
Mm,
based formulation. So that can be either given by prescription or through medical grade skincare. It does reduce the pigmentation.
mm,
There is good evidence also for the retinoids also help with that, because you're obviously taking off the dead skin on the top so it can lighten things. And those are the two go-tos, and then the prevention, right? So if that's not working, you can discuss with a dermatologist about laser treatments as well. So that's not the first line though. You should try other things. And there are things like IPL or fractional based lasers or Pico, depending on the type of hyperpigmentation. If it's more melasma, if it's patchy, what areas are affected, there are different lasers to help with that.
And who would you recommend that person goes to discuss this with? Is it a dermatologist? Is it a skincare, laser esthetician specialist? Who
It
would you
would
recommend?
definitely be a dermatologist
Okay.
who either is practicing in a medi spa or in a dermatological practice.
Hmm.
But I would advocate that you do speak with a dermatologist, because there are multiple different lasers. Some of them can actually make it worse
Yeah.
if you are going the laser route. And
Hmm.
with regards to the hyperpigmentation prevention, it is also a lot of the ingredients that I already talked about with regards to the sunscreen, vitamin C, and retinol, and then it would
Hmm.
be asking about a hydroquinone based skincare product as well as going to lighten. You can get a lot of those actually over the counter or at a medi spa, anywhere that sells medical grade skincare. If you're going for lasers though, then
Hmm.
I definitely think it should be done under the care of a dermatologist,
Right.
as well as just to review the skincare that you're using.
Quite honestly, there's a lot of med spas doing laser treatments that
Yeah.
are not being directed by a dermatologist. So I think buyer beware and make sure that you always have a licensed clinician behind even these med spas. It's a wide variety of these types of businesses around. So you have to do your homework with
Yeah,
that.
definitely.
Um, I want to just build a little bit upon that hyperpigmentation question, because this is an issue that really comes up a lot as women get older, somewhere after 35, especially if they've had children. Um, Sometimes not, but especially if they've had children, or the kinds of where your body has just gone through a massive amount of hormonal fluctuations. And for darker skinned women, and whether they're of African origin or they're Middle Eastern or South Asian, start to have dark spots, maybe even light spots that start to look like and other conditions that we know that have white blotches. And some of the products out there have active ingredients like kojic acid, which can really make you look literally bleached. So I happen to know, just because, I work in the, science innovation space. I happen to know a lot of companies, especially cosmetic companies, are spending a lot of
Yeah.
innovation dollars on hyperpigmentation creams. What can you share about your knowledge in that
Yeah,
area?
so I think when it comes to hyperpigmentation, there's different types of hyperpigmentation. There is melasma on the face, there's sunspots, so that's like from UV and lack of protection from the sun, or maybe not be wearing sunscreen. And then there's also something called acanthosis, which we commonly see in pregnancy, and also those with have insulin resistance. I think it's really important that you find out the root cause of your hyperpigmentation, whether it's related to menopause or if it's related to underlying polycystic ovarian syndrome. Maybe underlying diabetes or pre-diabetes can cause hyperpigmentation as well. So I think that part is really important. If you have insulin resistance, that's something that I see that goes, you can buy as many skincare products under the sun, but if you're not focusing on the root cause, then you're not really doing yourself a service. You're just kind of wasting your money. So differentiating, what type of pigmentation do you have? Is it related to insulin resistance? Is there some underlying disease process such as diabetes, PCOS, just, even pre-diabetes or what we call impaired glucose tolerance? Those things can be treated in other ways, such as lifestyle. You could use off-label metformin for acanthosis. Your question about kojic acid, I have seen kojic acid. I've used kojic acid myself for patients, but usually in conjunction with finding an underlying disease process. So I, work patients up for diabetes, or might work them up for PCOS, and we're working on that in conjunction to applying skincare, because there's no set formula of what's going to work. And obviously, if you have those underlying disease processes, those also relate to cardiovascular risk and relate to other comorbid issues that really do need to be treated, which maybe, we care about how we look, but we should also care about what we're doing on the inside of our body and longevity in that way as well.
Yeah, really great answer. I think the takeaway from that is if you're starting to have, dark spots on your skin, and not just spots, I mean patches, like you said, melasma, or the white patches, which could be a sign of something else.
So white patches could be vitiligo, which is an autoimmune process, and then with that comes other autoimmune issues. So again, blood work and workup by a physician is so important, rather than just going to the spas. There could be some underlying disease process.
Yeah, talk to your doctor first before trying all kinds of experimental products and treatments. Exactly. Great advice. We probably only have about 7, 8 minutes left. So I'm going to try to blast through a few more of these questions in the chat, because it's very busy. And in case we don't get to all the questions today, not to worry, because Dr. Pisani has been so kind to be able to answer them offline in quick answers, and we can provide them as part of the show notes. And thanks, Dr. Pisani, about that. But let's get through a last few questions. This one is from Valerie, and she's talking about noticing that in her perimenopause transition period, she's having all kinds of skin issues like hives, allergies, eczema, and unfortunately her gynecologist is not really helping her with this, because they're not trained in skincare most of the time, right? This is part of the the silos of the different areas of health. So she'd like to understand if there's a link between hormones and skin, or histamines, as she's put it here. Do you have any knowledge to share on this topic?
Yeah, so like I said, you're losing that transepidermal water-based layer, you're losing collagen, you're losing elastin, your skin is getting thinner. So that makes you vulnerable to things like eczema, contact dermatitis, which is allergy mediated. So it could be like, the products that maybe weren't bothering you before, such as your soaps or your laundry detergents, are now affecting you because your skin is thinner and irritating that area a lot more. There is a link with all of those things. And hives as well. It could be allergy mediated, it could be medication mediated. It could be like that you don't have, like it could be the loss of estrogen. So definitely speaking to a dermatologist or even an allergist could be helpful to find out if you are specifically allergic to something, and then increasing that skin barrier to protect yourself from other things. So like we talked about, increasing that collagen with moisturizers, your vitamin C serums, and also the rest of the body is affected too. So moisturizing your entire body is very important. Something that is like a water-based, you can even use Vaseline as a very simple thing to protect your skin. Obviously, if you're having contact dermatitis or like hives, that should be in consultation with a skincare specialist, such as a dermatologist. But there is a definite link there, and the physiology does make sense that that would happen.
Excellent question and excellent answer. There's another question here that's about women in menopause, and then I have a question right after that about women in their reproductive years battling a challenge with fertility, maybe because they have PCOS. So a little bit of two different situations here, but let's get to I think one of the last menopause questions we have here, which is from Helen. What are your recommendations regarding managing oily skin, such as your classic T-zone
Yeah.
problem, in combination with the drying skin effects brought on by menopause? You got the best of both worlds kind of thing.
So that's often the oily skin can be related to testosterone levels as well. So you definitely want to get your hormones checked to make sure that's not contributing, because then it would be things like androgen suppressing medication or birth control, or things like spironolactone. So again, testing underlying causes for the excess skin, looking at your diet, limiting greasy foods, making sure you're getting enough water. In terms of products, sometimes less is more in an oily based, if you have oily based skin, because the more you apply to the skin, and if you're not actually sloughing off the dead skin, you're just piling on more on top of the skin, which makes it oilier and oilier. So again, an exfoliant, retinol is really important. And then making sure that you are maybe it's trial and error. So maybe the vitamin C works and that's enough hydration for you. There are some sunscreens that are oil-based, and that might be contributing. So you have to really look at the products that you're using, and find out, are these oil-based products? Is there oil in these products? And maybe staying away from those, and not maybe minimizing the amount of skincare products you're using. Again, medical grade skincare really does help with that. I find, because they're less oil-based. There was one other thing I wanted to mention, and that is, and Rena, I think you just touched on that, is if you're in your reproductive years and you are planning pregnancy, it is very important to discuss with a skincare provider about what you are taking in attempts for pregnancy. You should not be on retinol, you should not be on hydroquinone, and you should be on pregnancy safe products. So, those should be stopped well in advance of conception, because we don't know what it does to the baby or a fetus. So I just wanted to get that point across as well.
Yeah, those are great things to say and caution people about whenever you're, in pregnancy or planning to become pregnant. It's the time you have to start changing a few of your normal routines, both with medications and food. So very good advice there. Good reminder too. I think we have time for one last question, and this is a question I have for you, for women who are struggling with fertility issues. They might be in their late 20s or even in their 30s, and they're perhaps undergoing or contemplating undergoing IVF or in vitro fertilization. And they may have PCOS as that challenge, okay? Or it could be even endometriosis in some cases. But I know a lot of women struggling with fertility may have PCOS. What skin issues do these women typically experience? And, are there any clinically effective products that you would recommend for them? Again, probably not while they're pregnant, but, if they've abandoned that pathway or they're not looking to become pregnant, what would you recommend for them? And I just want to add one particular active ingredient, which is spironolactone that you mentioned, because it is often associated with PCOS, and I'd love for it to be demystified here, for those wondering about it.
So basically, with PCOS, you have increased androgen levels, increased insulin resistance that drives an imbalance of hormones, particularly that you have more progesterone and estrogen, and then you have increased male androgens. For those who are trying to conceive or undergoing fertility treatments, you should not be on spironolactone. It is teratogenic and can cause severe fetal defects, and unfortunately that is one of the ones that helps with acne related PCOS that is acne, like causes acne. So you would have to be off of that, in which case you are going to rely on your lifestyle, so exercise, the sunscreens and the moisturizers, and just cleansing the face. But otherwise, when you're actively trying to get pregnant, you should not be on some of those active ingredients, the retinol, the hydroquinone, or the spironolactone. If you're undergoing fertility treatments, some people will use off-label metformin. It hasn't been shown to help cosmetically, but it does regulate periods to help women with PCOS who are having an ovulatory cycle, so they're not actually ovulating, in conjunction with your fertility clinic who might be working on something called ovulation induction. There's no evidence to show that metformin actually helps with skin, but I think anything theoretically, if you want to think about it, that reduces that insulin resistance that mediates PCOS, it could potentially help, but you're really just going back to basics on hydration and lifestyle at that point, and just a good skincare routine that is safe in pregnancy. And you're going to have to probably struggle through a little bit with the acne as well, just in that period of time. If you're not getting pregnant, then that's a whole different conversation about regulation of hormones. And that's when we discuss with PCOS specifically, again, it is lifestyle mediated, and it's reducing that insulin resistance through exercise and healthy diet. But also we should be balancing out the hormones, and that can be done with combined birth control pills. That's with progesterone and estrogen, plus or minus an anti-androgen, which is spironolactone. And those actually have evidence to reduce acne, hair loss related to PCOS, and really regulate the hormones in many ways. So I do want to demystify that, but that needs to be done in conjunction with your doctor, because there are hormones to be checked, your kidney function needs to be checked, and you really do need to be counseled on the risk if you do accidentally get pregnant.
Okay, well, that's a lot to process there, but it actually is potentially a segue for a future talk about hair, and the effects of hormones on hair growth, either too much of it, on the face in particular, or other parts of the body, or hair loss, which happens typically when you have thyroid issues, PCOS, those androgenic problems, even in menopause. Apparently, over 40% of women in the menopause transition do experience hair thinning.
I
And
just wanted to say one last thing is PCOS is not just for women in their reproductive years. PCOS can actually come on postmenopausally as well. And there are other causes for high androgens postmenopausally, and those also need to be worked out. So if you're experiencing those symptoms, you could also have underlying androgen issues and should be discussed with your doctor.
Thank you for saying that. Again, a great future topic that we could talk about with you,
Yeah.
because there's definitely many women in our community who struggle with those androgen hormones kind of taking over, whether it's coming through menopause or PCOS at various stages in their life that could come through lifestyle. Yeah, it may not be genetic, it may be something that is mitigated by lifestyle changes. So thank you for that. There's been great questions here that we answered. I think we answered everyone's questions, and I want to just take this moment to personally thank Dr. Pisani for spending this time with us today. It was fantastic. We learned tons. We put a lot of the highlights that you shared in the chat board, but again, there's going to be a more fulsome script of what we learned today from this event in part of our show notes, along with the video recording for those who've ordered that, and for our members who do get that automatically. There is a nice comment question from Jessica here that I'm going to address, because this is going to help us with the next part, the last 5 minutes of today's event. Thank you so much, Jessica, for saying all the wonderful words about today's event and in general about our platform. You asked about how to get access to specialized doctors like Dr. Pisani. Well, guess what? As a member of Healthier Life, you can get access to Dr. Pisani as through one of our membership plans, and I'll just talk about that in the last 5 minutes of today. But you're right, our mission is to help bring, the experts that we have in Canada. And Canada is really rich with lots of great medical health experts who aren't here to push a ton of products in your face, and they're really honest and have high integrity in the way they practice medicine. They're doing this as a public service. And really, I can't thank you enough, Dr. Pisani, for sharing all that you do for us today and
Um,
honestly many other days as our medical advisor as well. She helps
Thank
me
you so
personally
much
many
for
times.
having me. It was a
um,
pleasure, and I'm always happy to make sure to educate all the women in our community. So thank you.
oh, thank you so much. Now, I'm just going to close with a few quick slides for the benefit of everyone who wants to learn more about how they can meet and talk to doctors like yourself, Dr. Pisani. So with that, let me share again my presentation here. Let me just get to it back on the screen. Be patient, everyone. We're almost near the end. And of course, please share your comments in the chat board. We'll continue to address them. Even if you have other questions, we will get answers for them for you as part of the show notes after we wrap up. So I'm just gonna say we want to thank you for having listened and participated today and heard some of these evidence-based strategies to improve your skincare. And as I mentioned, Dr. Pisani is one of our medical advisors and also available for telehealth video consults through our platform if you are a member. And we also have Dr. Megha Podar, who is an endocrinologist as well, but she focuses her practice on weight management and obesity medicine for those of you who are really struggling with that. She is one of Canada's top experts in that field. And moving on, we have an interesting feature that we have introduced not too long ago, about 5 months ago. For those of you who are technologically oriented, as am I, sometimes you have a question. It's a weekend, late at night, and you can't get to a doctor very quickly or during a holiday, and you just want to have some evidence-based answers for a simple question. Many times the kinds of questions you asked today on the chat board. Well, you can just ask Haley, and Haley is our health AI concierge on our platform. And she's been programmed and trained to provide evidence from the clinical literature. We have a lot of people on my team working on her algorithms, and that could be sometimes a first go-to place to get some quick answers and share them, with a medical specialist as part of your next step. So try her out. And if you wanted to know about our membership plans where you can get access to the telehealth consultation services and access to Haley, your AI health concierge, at any time of day or night, we have these plans available that go beyond the free community member level, and you get access to all of our Women Talking Wednesday events, including the video recordings and show notes. It's all free and complimentary with an Explore plan, which is our entry-level plan, one 20-minute telehealth visit with a nurse practitioner, as well as the 24/7 access to Haley, our AI health concierge. You have exclusive member deals at our marketplace with health and wellness products, and we are going to be introducing some skincare products that Dr. Pisani has certainly recommended through her own clinic in Vancouver with her patients. They're coming soon, as well as other things like iron supplements and really effective personal products. Discounts of 15% or more off these products is what we've negotiated. And we're trying to bring them easier to you. These are not products you can find easily in your local pharmacy. These are really specialized products. And also access to our physician specialists like Dr. Pisani for a 30-minute consultation and care plan. And those are with the higher level plans like Activate or Optimize. And starting today, it's April 2nd. I didn't want to do this on April 1st, but starting today on April 2nd, and valid up until Mother's Day, which is May 15th, we have 10% promo off all of our membership plans. And this is the promo code that you can use. All plans save 10%. So just take a look at that here or point your camera at the screen captcha. And it'll take you straight to our memberships page. And these are the kinds of value that you can get with an Explore plan, which is our entry level plan. It's now with a 10% off, $198 per year or $18 per month. And like I said, you get all the benefits that I explained on the previous slide. So we hope you had a great time today and learned a lot at our event. We welcome you to join our hub if you're not already a community member, or to consider one of those membership plans at 10% off. And please help us spread the word so that you can get a healthier life. And I want to say to everyone, have a wonderful day wherever you are across this wonderful land. And enjoy the rest of the week. Welcome, April, and we hope to see you again soon at Women Talking Wednesday. And thank you, Dr. Pisani.